So some individuals experience a moment in time where their blood sugars get extremely high, or they're having a lot of illness that's coming from that high blood sugar. So oftentimes a person can get into trouble if they're not producing enough insulin to basically digest the food that we eat. And so if they don't get enough insulin, our body actually begins to start to burn fat, and we get ketones. Ketones is something that can spill into our urine, and we can often become very sick because of it. Most of the time, DKA is one of the complications, or HHS is also another complication that can require hospitalization. So an individual might have symptoms of high blood sugar, which could be increased thirst, increased urination. Some even actually begin to get nauseous and have vomiting and aren't able to really eat that well. So the best thing to do is to monitor your blood sugars closely, and if you begin to have symptoms of extreme thirst, extreme urination, or maybe even nausea, vomiting, it might be time to call your doctor and get advice as to whether or not you should seek hospital attention at the emergency room.
When your diabetes is not well managed, when its blood sugars have been running too high for too long, there are several major diseases related to uncontrolled diabetes. The first one, of course, is heart disease. Okay. Most people with uncontrolled diabetes will suffer from some kind of heart disease. And many people who die from heart attacks and heart diseases had underlying uncontrolled diabetes. These are statistics that you don't always see. Another thing, thinking about blood going everywhere in your body, you run the risk of retinopathy, which is a problem with your eyes, that the vessels behind our eyes are very, very tiny. And when they get too much sugar in there, it starts to make them puff out and get bigger and weaker, and they can burst. So you run into problems with your eyes too. Blindness, adult blindness, the number one cause is uncontrolled diabetes. Blood goes to your mouth, your teeth too. So gum disease is a big, big issue. People don't think about it as much. You brush your teeth, you drink some water. It's not something you notice until you go to the dentist, or until you start having loose teeth or something. Be mindful that an A1C, that average blood sugar at 9%, makes you 3 times more likely to have gum disease. It also means that your saliva is full of sugar 100% of the time, and you're not going to notice that. And you can't brush your teeth all day or take care of it, so it's going to affect your gums and your teeth there too. Nephropathy, or kidney disease, is also related to diabetes. Just like the eyes, there are little tiny vessels in our kidneys, and they can get damaged by too much sugar. One of the things your kidneys do is holds onto some protein, sends it where it needs to go in the body, so to speak, and be used, and it gets rid of all the toxins and the waste that we take in. When you have uncontrolled diabetes and it's affecting your kidneys, the function of the kidney flips, and it throws that protein out and ends up holding on to the toxins and the waste and the poison that you wanted to get rid of. So kidney issues can be a major problem too.